Hi everyone. Hello, hello. Welcome back. We are continuing our nursing school mindset edit. I want to apologize that I missed yesterday, dealing with some huge website issues right now. Maybe you've noticed our website's completely down. So that kind of hijacked my entire day, but we'll catch up, and I will provide a link to the topic I was going to talk about yesterday. Once the website is back up and running, I will get a link out to you guys for that, okay? All right, so pop into the comments. Let me know that you are here so I see your faces. And today we are just going to talk very quickly about a framework that I teach and use all the time for learning disease conditions. So, if you've been listening to my podcast for any length of time, this will not be new to you. We're going to talk about the latte method, okay? So, the reason this was developed in the first place, and hello to everybody saying hi, was when I was that first semester nursing student, my med-surg class, it's overwhelming, right? You're learning so much and it's really hard because you don't have context yet. You don't really know what to focus on. So you tend to focus on everything and then you end up way over studying. So we were doing case studies all the time as a way to prepare for exams. And each case study, I'm telling you, it was like a medical mystery. I felt like Dr. House, like going down these rabbit holes on the internet or in my textbooks, trying to just get every bit of data that I possibly could about this patient's condition in our case study, right? So these case studies would end up being like 14, 16 pages long. I'm not even kidding. They were humongous and took forever to complete. And I quickly realized I feel like maybe I'm over preparing for these exams. I don't think I need all this information, but how do I focus in on the must know information? So I came up with a framework and have used it ever since then. Thousands of students use it, nursing schools use it. It's really, really great in that it just laser focuses your brain to really think like a nurse while you're learning disease conditions, doing case studies, what have you. And that's the latte method. So I always start the latte method by first just I'll write like a brief summary of the pathophysiology, not a dissertation on the pathophysiology, you guys. 3 or 4 sentences. Like I try to keep it as short and to the point, um, as though a patient were asking me what the pathophysiology was for their disease condition. How would I explain it in just the most basic terms? Okay. So I start with that. That's kind of like the background for the latte method. And then we get into the letters. So it's LATTE. Okay. And if you love coffee as much as I do, this will be great. You'll remember it forever, right? So L is for look. How does the patient look? And this is kind of a general catch all term for how do they present? What might they be complaining about? What do you notice when you look at or observe or interact with them? What do you see, hear, smell? All of that. Like, what are you taking in with all of your senses when you encounter this individual, okay? What signs and symptoms are they experiencing and exhibiting, okay? So that's look. So let's say we have a patient with pneumonia, for example. The L might be something like they look like they have increased work of breathing, they're coughing a lot, their sputum's really thick, you hear adventitious lung sounds. Their SpO2 might be low. Their respiratory rate might be high. They might be telling you that it hurts their chest. Their chest is hurting because they've been coughing so much or they've got inflammation in there. They may say they're fatigued. They may look fatigued. those kinds of things that you might notice about a patient with pneumonia. They may have a fever, et cetera, et cetera. Okay, so that's what the L stands for. How do they look? The A stands for assess. So how will you assess a patient with whatever disease condition it is, right? So for our pneumonia example, things that I would want to assess with this patient are, I'm going to assess their vital signs, right? I definitely want an SpO2 with that and a temperature with that. I want a respiratory rate for sure. Heart rate also, because heart rate's going to go up when you have infection. It's going to go up maybe when you have increased work of breathing, etc. I will also want to listen to their lungs. I'm going to assess their lung sounds. I'm going to assess their sputum if I can get a look at it. How thick is it? How much is it? What color is it? Does it smell really bad? Those sorts of things. I'm also going to assess their ability to speak in full sentences. If they're only getting out 3 words, that tells me they're really short of breath, right? So those are some things that I would assess on a patient with a suspected pneumonia. There's probably other things. I'm just speaking off the top of my head right now. And then the first T, so there's 2. The first T is for tests. What tests would you anticipate the MD ordering? So this would be things like, well, I'm going to anticipate a CBC so that we can check for an elevated white count. I'm going to anticipate a test for a sputum culture if we're really going down that road of infection, right? And I'm going to anticipate a chest x-ray. If the patient's in dire condition, I would also anticipate an ABG. Those would be the key things that I would anticipate test-wise for a patient who's come in with a pneumonia, okay? And then the next T, the second one, is for treatments. So what treatments are going to be provided for a patient with pneumonia or whatever disease condition you're studying? So this would be all the things that you're going to implement that the MD orders and all the nursing interventions that you're going to do independently. So I'm going to have the patient cough and take deep breaths. We're going to give oxygen as needed to keep them above whatever parameter the MD orders, probably above 90 or 92%. I'm going to be administering the medications that have been ordered, such as antibiotics, anti-inflammatories. Me or the respiratory therapist will be giving nebulized treatments, inhaled treatments, encouraging fluids to help decrease the thickness of that sputum, encouraging activity as tolerated, providing rest periods as tolerated. Maybe we're doing some postural drainage, things like that. So that's what the second T stands for. And then E is for education. Some disease conditions have a bigger education component than others. You just want to make sure that anything really key that the patient has to know, you include in this section, because a lot of times you're sending patients home and you want to make sure they know what they need to know, like when to call the doc, when to come back. Let's say they are taking a medication that requires they count their heart rate before they take it, or that they avoid grapefruit when they're taking it, or things like that. So that is your, in a nutshell, guide to the latte method. I'm telling you, it is amazing in giving you that laser focus on what to actually study as you're learning disease conditions. So if you want to check it out in action, many of these Straight A Nursing podcast episodes where I talk about disease conditions use this framework, okay? I would point you to my website right now, but it's down. It will be back up soon. We're working on it over here. So, but you can go to the podcast wherever you get podcasts, Apple Podcasts, Google Podcasts, I think is what it's called, Spotify, etc., and just search through and find a disease condition episode, and most likely I'm using the latte method to talk through that, okay? So I hope that helps you guys feel like you've got a framework to use so that you don't feel like you're starting from scratch when you're learning about disease conditions, and so you don't overstudy. I don't want you to waste time doing that. And so you really do study the things that you need to know for your exams, okay? Oh, thanks, Cami. Cami says she loves the podcast and listens on the way to class. Very good. I love that you guys listen while you're commuting, exercising, folding the laundry, unloading the dishwasher, all of those things that you still have to get done, right? Okay, so tomorrow we're talking about dealing with nursing school stress. Unless there's some unforeseen website catastrophe, I will be here to talk with you guys, and that will be at 10 a.m. Just with the caveat that if I, for some reason, don't show up or have to cancel the event, it's because we're having a website issue that needs my immediate attention. I'm really trying to get everything set up today for a successful reboot of that. Okay. All right, everybody, have a fantastic day, and I will be seeing you very, very soon. Bye.